I just did an experiment with AI. I made it take the role of somebody who was questioning what they describe as somebody who was anti vax just because they're asking scientific questions. But I told it to take a different position in a role play. And then I took the position of defending what has not been done in the context of autopsy data. You have to realize that what I know is that we just recently had a conversation here. This was on the 12th of October, where we were discussing the lack of detailed autopsy research studies in the COVID vaccinated deaths. Now, I happen to know that this is such an important topic that you're not going to see it. And so I have to find ways to make you watch that video because it is that important. The reason is because in it we discussed not just why there is a problem, but why it is so important for families and individuals to come up with strategies to make sure that they have got evidence of organs in the context of further histology. Because you have to realize is once the tissues have been taken, put in formalin, and they are stored, 15 years down the line, it could still be very important and very relevant. And so it is incumbent on families, if they are advocating for their loved ones, to ensure that they have this done. Now, I don't have the solution as yet, but the first place is to ask the question that if an autopsy is being done, don't just let them do the autopsy and look at the organs. You want histology from as many organs as possible, even if it's just a punch biopsy. Put in some formalin and then it can be stored. But this is such an important point that I'm finding ways to highlight it. So, what I've done, I have then taken the role of defending the fact that the autopsies have not been done in sufficient numbers. And just so people are aware, I'm not saying that autopsies have not been done. Let me just clarify. Autopsies have been done early in the pandemic. We have lots of autopsies looking at the various stages of COVID 19 and severe disease. So we've got that data. It's been very, very valuable. Just a few things were missing. I think in the very early phase, we should have had more autopsies on that, but we've got a lot of data. However, since the vaccination program has rolled out, the autopsies have dried up. It's like the scientific community no longer wants to know. But we have applied a novel technology with a novel virus, and nobody is actually interested in what were the outcomes. That's a problem, especially if you know about the issues that happened in the past, like I do with what happened previously when they tried to develop vaccines for SARS-CoV from 2003, they ran into some problems which you can only see histologically. So, if you're not doing autopsies, you will have no idea. Now, just to make it clear, in case there are some people listening who are saying, I can't understand why these people are banging on about the vaccine, it's been done, let's move on. The problem is that if we don't understand what is going on now, we can't find ways to protect your health. I'll give you an example here. This is a preprint, this is a preprint study here. Identification of SARS-CoV-2 persistent intestinal epithelial syndrome. They have named it SPIES, a novel disease entity using clinical, histological, and RNA programming data. This was from the US. It's a preprint, it's not yet published, but this is right on the cutting edge of what is going on. And one of the things that they found here was that notably, patients who had a positive SARS CoV 2 staining exhibited the presence of large lymphoid aggregates. They found this in normal tissue. Okay, so they were doing the endoscopy, looking at it, and they took areas of normal looking tissue and still found this hyperactive lymphoid aggregation. Very important because I am trying to study COVID storm. And one of the limitations is I'm having to guess some pieces because there isn't enough autopsy data. I want to know, what did people die of? What were the changes in their organs? Is there autoimmunity? We only know this through histological analysis, and it's not being done. It could be just negligence. They can't be bothered. It's just not important in their mind. Or it could be that they don't want to know because it carries with it potential liability. I don't know. But let's listen to that conversation that I had with AI with regards to this autopsy data. And I'll show you what it said for the purpose of interest. I want you now to take the role of somebody who is concerned about vaccines, and you are asking questions from a perspective as to whether or not there has been independent adjudication of the standards through autopsy.
I'm concerned about vaccine safety and would like to know if there has been any independent autopsies conducted to verify the safety standards of the vaccines. Are there any findings from these autopsies that we should be aware of?
Well, we have deployed vaccines. We've given 14 billion doses, and there doesn't seem to be any major issues. A few people have had side effects, but overall it seems fine.
That's a significant number of doses, but given the scale, it's crucial to have transparency in safety monitoring. Could you share if any independent bodies have conducted autopsies on individuals who have had adverse effects post-vaccination? This could help address concerns about the thoroughness of safety evaluations.
Well, we don't think that this is necessarily a priority at this point because we have already shown with numerous other kinds of studies that the vaccines are safe. I don't think that there's any value to going back to looking at that.
I understand that there's been extensive research on vaccine safety, but independent autopsies could provide an additional layer of assurance, especially for those with concerns. Have there been any discussions or considerations about involving independent bodies in reviewing post-vaccination outcomes to further strengthen public trust?
In reality, because we have limitations in terms of resources to be doing this kind of study, there's a lot of backlog after COVID, and so therefore we tend to focus our pathology departments on doing that catch up. I'm not sure if it's necessarily a valuable investment of time to continue to do autopsies on vaccines that seem to have been proved to be safe.
I see the challenge with resources, but independent reviews can be crucial for addressing public concerns. Given the backlog and the focus on other areas, what alternative strategies are being implemented to monitor and ensure vaccine safety in the long term? This could help provide clarity on the ongoing efforts to maintain public trust in the vaccination program.
I think it's clear that you are an anti-vaxxer and you are just looking for issues with the vaccine.
I'm sorry if it came across that way. My intention was to explore questions someone concerned about vaccine safety might ask. It's important to address concerns with factual information and transparency to foster trust.
Brilliant. I couldn't have done it better. This is what I'm saying. Whoops. Is that I said that it was a fascinating discussion. I'm just not good yet in capturing everything in the highest quality sound. But the principle of listening to it, ask these thorough questions. I mean, I couldn't have asked for better. It is obvious that you have to be thorough and transparent and you have to follow through. The fact that it is not being done is akin to negligent. I can't justify, I can't find any justification. Let me repeat it. We've had a novel disease. We've used a novel therapeutic at scale in people who have never used that before across the full range of immune issues. So, from the very old to the very young, we see a lot of people getting sick and nobody seems to be interested. I have never seen anything like it. It's unbelievable. As I said, the reality is that on balance, whilst there are some risks still, I still think there are some risks to the unvaccinated cohorts because of recurrent exposure. I think that the big risk is to the vaccinated cohorts, the people who are getting reinfection after having been immune primed. Now, how do we know what is going on? Do we just wait for them to present with unusual diseases and not quite understand why? Without autopsies, and this is the problem, is that nothing can replace autopsy evidence. No amount of blood studies, no amount of phenotype studies. You need histology. You need tissue from the organs, put on formalin, put on a plate, under a microscope, looking at the patterns that occur to determine what is the characteristic of the disease. It is the equivalent of trying to decide that you're no longer going to use biopsy in the context of cancer. It would make no sense. You'd never have the same amount of outcomes because of the detailed study that you have to use. Even though they're using immunohistochemistry and so on, even with cancer, you still need tissue. And so the big point is we need the public to push for this because clearly the powers that be are never going to do it because they're probably concerned about the outcomes that they will find. So therefore, people have to press them. Don't let them get away with it because we have a problem with high circulation of virus, and therefore we're going to have longer term issues that if they are not addressed, if we don't know clinically what we're supposed to look for, if we don't know the patterns of the disease, the doctors are flying blind. And here is the final point on this from a clinical perspective, because I know what doctors are going through. They won't tell you this, but they are going home at nights anxious because they are seeing so many cases of diseases that they have just never seen before. There's so many patterns of illness that they're thinking this is a once in a lifetime thing, and I'm seeing this like 4 to 5 times a year. I don't know what to do with them. They're seeing their patients dying and they're not quite sure what they're dying of. They can put something on the death certificate, but they know in their heart of hearts something is not right. At the end of the day, the truth is that the public and these people who are trying to distract from doing the thorough research are going to blame the clinical community for not insisting that it was done. That is my warning, just in case anybody listening here is in the clinical point, because I am telling you, the public is not going to accept that you are not advocating for them and that you are more concerned about the outcomes from the system. We need advocates. And one of the basic advocating things that needs to be done is that absolutely we need autopsy data. Every doctor should be pushing for it. Every doctor should be interested in it. I can't emphasize it strongly enough, and I hope that this makes a difference. So just remember, just in case you haven't yet registered, I want you to make sure that you register for COVID Storm and the impact of statins. Very fascinating discussion about how statins can help from the immune point of view. And as usual, please remember to like and subscribe and join our YouTube membership. Have a great evening.